Hello, and welcome back to the Urology Care Podcast, the official podcast of the Urology Care Foundation. We are back with our two guests, Dr. Eugene Lee and Dr. Kowalik, to discuss overactive bladder, also known as OAB. For those who missed part one of this conversation, Dr. Lee is a urologic oncologist and associate professor for the Department of Urology at the University of Kansas Health System and has lived with OAB most of his life. Dr. Kowalik is a urologist and assistant professor who specializes in female pelvic medicine and reconstructive surgery, also at the University of Kansas Health System. Whether you have a busy lifestyle or are just looking for some relief during normal day-to-day activities, this episode dives deeper into the conversation of OAB and how to manage this condition on the go. So let's not waste any more time and get back into it. Dr. Lee, as a doctor, we kind of talked a little bit about this previously. You know, I'm sure your work days are quite busy, and I know a lot of people can probably relate to that, having a job that may not allow them, to have multiple bathroom breaks. The first job that kind of comes to mind is a teacher, for instance, who is teaching a class and, may not feel comfortable to just leave the room to use the bathroom. I'm sure there's plenty of other jobs that, kind of have that same atmosphere. So what are some of your best tips that you can share on how you manage your OAB on a daily basis that other people may be able to take with them and use in their life?
Yeah, I mean, I would say from my job standpoint, I can't honestly say, yes, it's busy and we have a lot of things that we're doing, but I am lucky in the sense that I don't ever feel restricted in the ability to go. And so, but I do know that there are, obviously jobs where it is more restricted. What I would say is that, the things that we harp on to our patients is very true for me, which is, timed voiding, making sure that you empty your bladder on a regular basis, whether you feel like you have to go or not. Double voiding, making sure that you go and you try again whenever you do go to the bathroom. But I think what Dr. Kowalik is saying is very true in terms of just even general management type things. The avoidance of caffeine. It's from a patient perspective, I'm a coffee drinker. And I know that coffee exacerbates my symptoms. And as I tell my patients, sometimes I say, I drink coffee knowing what the consequences are going to be, but I enjoy my coffee enough that I'm willing to live with those consequences. But if your symptoms are bothersome enough that you're, taking medications or needing procedures, but you have to make that decision for yourself. And so what I would tell patients is, if you're drinking coffee, if you're drinking caffeinated sodas, if the bulk of your fluid intake is not water, then I would reconsider kind of those choices. From a personal standpoint, constipation is not an issue for me, but I know that when I'm talking to patients, it is a big issue for a lot of people. Our diets are terrible in general, and people don't get enough fiber, fruits and vegetables, and I think that that's a big component of this as well, too. So putting on, from a physician standpoint, I find myself, I do, even though I do urologic oncology, I do a general urology clinic once a week. And so this is kind of where a lot of my experience is coming from. But I spend a lot of time talking to people about constipation and caffeine intake, that in of itself. So I know I didn't directly answer your question, but I would say that just kind of even conservative management, I think, helps so many people when people are compliant with those kind of two things. I have a number of people that come in and they say, I'm so much better from my urinary symptoms because I'm not constipated and I cut out, caffeine.
I can add in a couple more points that I've had other patients tell me. I think we get really caught up at work. I got to answer that one more email and sort of suppress and ignore that urge. And then that can result in a urine leakage episode, at work or while we're otherwise busy doing things. And so I would say, don't wait too long. If you get the urge, just stop what you're doing if you can, and then use the bathroom. And the other thing is that if you do sit to urinate, make sure you're not hovering over the toilet. That can also prevent you from completely emptying the bladder. So it is really important to be able to sit on the toilet and relax all your pelvic floor muscles in order to make sure you're emptying as best as possible.
Those are all really great points. Thank you. And so, Dr. Kowalik, something that you said that was really interesting in terms of using the bathroom regularly and, not waiting to use the bathroom. Is that something that if someone does make it a habit to not go as frequently or hold their urine throughout the day, is that something that could eventually lead to OAB or cause OAB? Or is it really just an issue if you already have OAB symptoms?
A little bit of both, actually. So if you chronically hold your urine, when you're younger and up through maybe 20 years or even older, that over time can result in pelvic floor dysfunction, which can lead to overactive bladder symptoms. I think somebody that already has overactive bladder symptoms, we talk about timed voiding, just going to the bathroom prior to even feeling the urge. Because in some patients, you get the urge and then the urine leakage may happen within 30 seconds, which is just not enough time to make it to the bathroom. So if you can get your bladder empty before you even feel that urge, then hopefully you'll reduce some urinary leakage episodes.
Okay, thank you. How do you think people can best feel supported in their lives while having OAB? Dr. Lee, I know you mentioned, when you have meetings, your colleagues kind of know if it's a long meeting that you're going to have to use the bathroom. So it seems like, you have people around you who, support you and kind of are understanding. How do you think other people can feel supported in that same way?
Well, I mean, obviously, I'm in a unique situation because all my colleagues are urologists. And again, I'm sure you can tell, I'm not that private of a person in general. So kind of my business is kind of always out there, regardless of what it is. And so, I mean, I always am just very honest about it, and I kind of bring humor to it. And I think that's why I don't think it's that big of a deal as I approach it as just a chronic medical condition that I deal with. But again, I recognize that that's a little bit unique of a situation being in the field that I'm in. I just think that for people that it's affecting their daily lives or their work, having that conversation with the people around them that they need these times to be able to do what they need to do, I think is really important, and to not have to kind of, quote unquote, hide in the shadows of this, that it is a very common condition. And case in point, this is a little bit unrelated, but it's a story that I've shared before where I had a patient who had prostate cancer that we found out that he had urinary retention and was carrying 5 liters of urine in his bladder, and we didn't recognize it. Well, he started to share that with people and then realized that his own brother had been having the same issue for the past 20 years. And so I share that as an example of, I'm willing to bet that when patients are open about it to colleagues and work people, that I think it really can spiral. And I'm sure there's other people in the office or at their work environment who are also dealing with the same issues that they can bounce things off of. So I guess that would be the easiest answer that I can give.
I've had some of my patients get support through some online groups on social media. There's a lot of overactive bladder support groups. And then I think, like Dr. Lee was saying, just normalizing the conversation around overactive bladder, I think can really help people to share their stories and recognize that it actually is very, very common and people shouldn't have to suffer with their symptoms. And then probably the best bet is discussing your symptoms with your physician, because there really are treatment options that can help control the symptoms.
Thank you both. What are some of the most common questions that you get from patients about OAB and how to manage it at work and on the go? And how do you respond to those questions?
I think one of the most common questions I get is patients asking me if this is all psychological, because they'll notice that when they're pulling into their driveway every day getting home from work, or they're putting their key in the door, that's when they start to get the sudden urge to urinate. And that actually is a phenomenon called latchkey incontinence. And some psychologists think that it has to do with sort of that habitual behavior that people go to the bathroom as soon as they walk in the door. But the reality is that you do have an overactive bladder if you have those symptoms. And so it's not all psychological.
I will say that I get asked quite a bit, am I going to have to take this medication for life, or is this something that's, curable? And so for me, obviously, I've been dealing with it for my entire life. And so while it's not, I mean, I guess I'll defer to Dr. Kowalik. I wouldn't say it's curable, but it's manageable.
Yes, absolutely. Outside of some sort of finite instances of like a urinary tract infection or severe constipation, most patients with overactive bladder, this is a chronic condition. And so our goal is really to help manage the symptoms to improve your quality of life. But generally, if the treatments are stopped, the symptoms are going to come back. Okay.
And so people who either have a busy lifestyle, if they're traveling, if they're going on vacation, or, what would you say to someone to best manage their symptoms at work on the go? Is there kind of a overall approach that you take, or is the management something that's specific to each patient?
I think it can be specific to each patient. Sort of the general recommendations I say, though, are avoiding caffeine, avoiding alcohol when you're out and about and can't easily get to a restroom, making sure that you do use the restroom when it's appropriate, and not waiting too long. And then, of course, the other things that we've already mentioned, like avoiding constipation long-term, can all help.
Is there anything else that either of you would like to share, either from a personal or professional perspective, on managing OAB on the go?
I think just that it can take years for patients to come and talk to their physician about it. And I think a lot of that is because they're embarrassed. And really, you don't have to be. As physicians, we're very, very used to talking about this. And if it's significantly impeding your quality of life and affecting you, then there are a lot of options out there that can help.
Well, thank you to both Dr. Lee and Dr. Kowalik for taking the time to be on today's episode of the Urology Care Podcast.
Thanks for having us.
Thank you very much. I appreciate it.
Patient resources provided through the generous support of Astellas. This podcast has been brought to you by the Urology Care Foundation, the official foundation of the American Urological Association. For more information on today's topic and for all things urology health, visit urologyhealth.org. That's urologyhealth.org.